The hidden dangers behind the muscles, a story of bodybuilding's silent risks. It begins with a stage, bright lights, and the thunderous applause of a crowd. On that stage stand men sculpted to near perfection, symbols of discipline, strength, and the relentless pursuit of physical excellence. But behind the shimmering trophies and the admiration lies a story few ever hear. The story of lives cut short, often without warning, by the very pursuit that made them icons. In recent years, whispers have grown louder in the world of competitive bodybuilding. Reports of young, seemingly healthy athletes dying suddenly have sent shockwaves through the community. These are not isolated incidents, but a pattern that has left many questioning what truly lies beneath the surface of this demanding sport. Driven by a desire to understand the risks, a team of researchers set out on a daunting task. They combed through thousands of competition records, tracking over 20,000 male bodybuilders who had stepped onto the international stage over a 15-year period. Their search didn't stop at official records. They scoured news articles, social media, forums, and blogs in multiple languages, piecing together the stories of those who had died. The findings were sobering. Among these athletes, 121 deaths were identified, with the average age at death just 45 years. Most striking of all, nearly 4 out of every 10 deaths were sudden and cardiac in nature. The risk was even higher for professionals, who faced a more than 5-fold increase in sudden cardiac death compared to amateurs. Autopsy reports, though rare, painted a troubling picture. Enlarged hearts, thickened heart walls, and in some cases evidence of coronary artery disease. Toxicology reports and public records sometimes revealed another culprit: abuse of anabolic substances, a shadowy companion to the quest for the perfect physique. The story doesn't end with the heart. About 15% of the deaths were sudden and traumatic: car accidents, suicides, murders, and overdoses. These tragedies hint at deeper psychological struggles, sometimes worsened by substance abuse, that can accompany the pressures of bodybuilding culture. What emerges is a complex portrait of a sport that, while promoting fitness and self-discipline, also harbors hidden dangers. Extreme training regimens, rapid weight loss, severe dietary restrictions, dehydration, and the widespread use of performance-enhancing drugs all place immense strain on the body, especially the heart. For professionals, the risks are magnified by the intensity and duration of their commitment and the relentless pressure to achieve ever more dramatic results. The message for athletes is clear: the pursuit of physical perfection should not come at the cost of health. Safer training practices, better medical supervision, and a cultural shift away from dangerous shortcuts are urgently needed. For clinicians, the findings highlight the importance of proactive heart screening and counseling, even for those who appear to be in peak condition. And for policymakers and sports organizations, the call is for stronger anti-doping measures, education about the risks, and health surveillance programs tailored to this unique population. Perhaps most importantly, this story challenges the myth that appearance alone is a sign of health. The most chiseled bodies can hide vulnerabilities that only careful attention and honest conversation can reveal. Strength training and fitness, when approached wisely, remain powerful tools for health and longevity. But the bodybuilding world must reckon with its hidden risks, because behind every champion's pose, there is a heart that deserves to keep beating.